Today's December 16th. We're here with Edith, who's here for her second visit with me. Edith comes a couple hundred miles away from Grass Valley, California.
Gladly.
And she's a happy camper.
That's right.
Let's talk about your back first. When you first came to see me, you couldn't sit for more than
10 minutes without excruciating nerve pain, sciatic nerve pain in my hip, and I couldn't sleep at night because it would wake me up after I slept about 3 hours. I could not go back to sleep because of the nerve pain.
And we did one Prolozone session on you. We've done a second one today, but with one Prolozone, tell the viewer what happened.
I sat for 15 hours that day because I had a long drive back and forth, and I had no nerve pain. And the nerve pain has stayed away completely. That was a week ago, and then I just had another shot because I was having a little bit of muscle pain, but no nerve pain. It's gone.
So you've gone from 10 points of pain on a scale of 10, 24/7.
Yes, for 5 years.
For 5 years to 0. And you've been to a lot of people, is that correct?
I've been to so many people, complementary, alternative, conventional, everything. I tried every device known to man.
Okay. I'm glad you're a happy camper. That makes my day too. The other main thing is you were having a lot of loose stools. In fact, you told me explosive up to 20, 25 times a day. Is that correct?
Yes. For 8 years.
And
it got worse.
And you've seen a lot of people for that too, correct?
Tons of people, and done every cleanse and the zappers and all the complementary stuff you could do.
What happened here?
Within an hour, was totally different. I don't have to take psyllium. I'm not living close to a bathroom, and life is good. I can digest food. I can digest food without digestive enzymes and hydrochloric acid, and my digestion is phenomenal. And it's 90% better, and we just discovered today another layer. So.
Right, thank you. For the viewer, I may share, correct?
Yes.
And this is postable on YouTube, yes?
Yes.
Okay, for the viewer, I used kinesiology on you, which is muscle testing. It's subjective, but it guided me, and it suggested to me that you might have parasites in you. And I gave you a drug, and I'm not against drugs where they're indicated. Everybody needs to know that. In your case, it was Flagyl or metronidazole, which is good for amoeba. And what's interesting is your husband came back from India with you around the same time with similar conditions. So very likely you picked up a protozoa. And after a couple days of that, you had dramatic change. Is that correct?
Within an hour.
And no one picked up on this?
No, and I really am against medications in general, but this was an intervention that was critical. And I tried allopathic medicine as well with another physician, and it did not address it. I think because of the muscle testing made the difference to just figure out what my body needed.
Well, that's why I like kinesiology. Again, it's subjective, but it's a guide for me to make it a very specific treatment for you and what your immediate needs are.
Yeah.
Okay. Thank you very much.
Thank you.